Good day, everybody. It's Mark Arnstein, Remax Hallmark, and of course, livingnorthtoronto.com. Welcome to the Mark Arnstein Show. Today, our guest owns and operates Avenue Road Dental, located at 1916 Avenue Road, just north of Brook Avenue. He graduated from U of T in 1988, where he received an award for clinical oral surgery. In 1989, along with his wife, Dr. Morrow, they opened Avenue Road Dental as they wanted to build a community practice in the neighborhood in which they live and still do to this very day. Over the years, they continued to grow the practice with a family-first approach. In the last 5 years, they did an incredible expansion, renovation to their clinic, adding cosmetic and implant dentistry. They have 3 daughters, two living in California. Both are dentists working at UCLA, and their third daughter is in her residency at McMaster's University in pediatrics, which you got to be a very proud papa for that one. 3 very accomplished girls. And currently on their staff at Avenue Road, in addition to Dr. Morrow and Dr. Mincer, is 1 oral surgeon, 2 an endodontist, and a periodontist. It is my pleasure to welcome Dr. Sam Mincer, as I finally call him, Dr. Sam, to the show. Welcome, Dr. Sam.
Thank you for that glorious introduction. And well, good morning.
I try to beef you up as much as I possibly can before we get started, so you feel really good and warm and ready to just kind of all kinds of wonderful advice in the wonderful world of dentistry.
Thank you. Well, families like you that help keep us happy and operating the way we do.
Yeah, well, we've been with you. Oh my God, how many years since we lived in Toronto? 2004. So
yeah, since 2004. Yeah. That's right.
Yeah. Since we moved here. So, so what brought so did you already have the house up here before you guys decided to open the practice, or was the practice first and house second?
So we lived in the area when we finished school in 1988, and right. We were associating in different areas of outside North York. And then we decided, you know what, we love the area. We want to be able to maybe keep the family here. And we decided to open the office there and be able to walk to work, which we do every day.
No, I know. I see you guys all the time because we both obviously live very close to each other. So we're in the neighborhood as well. And I always see you guys out walking around, especially with the dog. Over the years, the different dogs you guys have had, so which is nice.
Yes. Our big dog typically walks us.
Yes, I know the feeling. As does ours. Okay, so you opened the practice in 1989, and now when you started originally, was it just the one level, or did it already have a second floor?
We started with 1 chair.
One chair.
And 1 chair on the main floor, and we didn't know how things would go, and we were still working elsewhere. I was still working in Scarborough and Mississauga. Marlene was just finishing up. She was doing a maternity leave out in Lorne Park area, Mississauga, wonderful area also.
Right.
And she left that and sat at the office, and we've now grown to about 12 chairs. So from 1 to 12, and we've needed to do a number of expansions in the area and patients in the area, and locale has been great to us. So we're rather established now. It's busy office, and we're looking forward to having 1 or more of our kids come back and help out at some point.
Is that actually the plan? Is for them, one of them to come home, or?
Yeah, that was a plan long ago. My eldest, Reva, who finished dental school about 5 years ago, has been attending after finishing a residency at the UCLA Dental School and the Weintraub Center for Reconstructive Dentistry in Los Angeles. It's part of the Ronald Reagan Hospital as well. So they made a position for her, actually. And so she's been doing a number of different projects, research. She treats a lot of medically compromised and challenged patients,
right,
while they're either asleep or in hospital. So the plan was for her to come back after dental school, but they made this position for her, so she couldn't not take it. So she's been doing that. And our youngest, Melanie, who's now finished dental school, is one of her residents at UCLA. So we're hoping that they don't steal her as well.
Well, University of California, Los Angeles, Toronto, I mean, that's going to be a hard one to get them to come back. I mean, like that, I don't think you'd be able to get me back if I was one of your kids doing that.
You know what? It's a great area. What they do is they wouldn't be doing it here in Toronto.
Right.
She's quite accomplished, and she could probably teach me a lot of stuff if she did come back. But we're hoping the youngest will be back in about 11 months.
Right. Okay, cool. Let me ask you this. Has there like been a lot of massive changes in the way the practice is run, or the way dentistry is practiced today, say compared to when you first started, from 40 years ago versus today?
Absolutely. We've seen, technological changes, digital changes, digital x-rays, digital impressions, digital reconstruction, digital planning. Everything is sort of technology based today. So there's been quite the changes. We've also been lucky enough to have the demand to have our specialty teams in office to help us out with patient treatment. So it's all focused in one spot.
Right.
And patients have less traveling to do for whether it's some reconstructive work, surgical treatment, wisdom teeth even. So it's in-house for us, which is lucky. We have some great teams that help us out.
And what made you decide to start bring everybody in like that? So to bring in like the periodontist, the endodontist, the oral surgeon, Dr. Oh God, what was that we call him? The young kid, Doogie Howser, Doctor, yeah.
Phil Walton, yeah. Dr.
Yeah, because he's got such a baby face, yeah.
He's a great clinician, Harvard grad. People love him. He's a practice builder for us.
Yeah.
And having him in house is we can sort of coordinate the best way to treat something without having to do it over the phone. We can clinically do it chairside with the patient there. So there's no broken telephone. And there's less time taken away from the patient's schedule, our schedules, and the patients get top drawer treatment. He's fabulous.
Right.
So we brought him in for that reason, that we could keep everything in-house, less travel for the patients. Same with our endodontists and the oral surgeons that come in to help patients out. And people don't want to travel today. I mean, traveling. My 8-minute walk to work, if I had to travel somewhere else for 45 minutes, I'd get there, I'm ready to go home and have a nap. It's, takes part of your day. And we've had lots of patients that have changed over to our office because they don't want to do that half-day travel and parking somewhere. And even with the pandemic, with the last 3 years, people that don't work downtown anymore or go in 2-3 days a week because of being able to work virtually have, luckily for us, come to our office and say, I'm not going back downtown. It's too much of a challenge.
Right. No, look, there's definitely, I can obviously speak to it because I work a lot in the neighborhood as well. And there's something very nice that, just being able to walk, also like walking down the street and just seeing seeing patients and seeing people that and
every day.
Just to say hi and, shoot the, and it's exactly what you wanted. You wanted a family community-based practice, which I think you've done a phenomenal job of building over the years, for sure.
Thank you. Yes. Well, many times my 8-minute walk becomes 18 or longer minutes because we bump into patients, and every night we walk the dog. We're meeting up, seeing people, and it's fun. It's nice. It's good life, good area. We've enjoyed it. We've been there, as you said, since '89, and going on a few years now. Time flies. We're now treating grandchildren of our original patients.
Oh, wow.
Yeah, so 3 generations still coming in.
Right. Well, I will say this with no offense. I hope that's definitely a long way away from my family. So
happens pretty quick. I was shocked. I turned around and boom.
Right.
It's quite amazing.
And what's it like working alongside with Marlene as far as like that going? And, because I think if I had to do it with my wife, I think actually I don't, as much as I love my wife, don't get me wrong, I say it with all due respect, I think we'd kill each other. I think
Well,
it would be insane.
people ask that all the time. How do you work with her right next to you in the office? And quite frankly, if I'm in the room with a patient, I'm with a patient. I'm not working with her.
Right.
But you know what? If I need to step out, if I have an appointment to get to, if I want to go pick something up or get a coffee, she's there to look after the office, and I don't have to worry about leaving or stepping out for a bit, half a day. Um, I think, thank goodness, I've had maybe 2, 3, 4 sick days in 30 odd years. So if I can't get out of bed because of some reason, she's there to handle the office. So
Right.
uh, it works well. And when my kids were younger, she was spending time raising them, activities, programs, school, teachers, PTA. So she was doing that, and I was at the office more. So it
Right.
worked out well, beneficial for our kids actually.
Yeah, no, for sure. Well, and look, I mean, you got 3 unbelievably accomplished girls. So, I mean, like I said in the introduction, I mean, like you definitely got to be proud parents with what they've
Yeah,
accomplished. I mean, that's pretty
we are
unbelievable. Yeah.
we are they're accomplished kids. It's nice to see. It's good that they're sort of working, and they're working not only just for themselves, but what they do is sort of giving back to the community. I mean, my middle one, Jackie, who's right now she's at the Brampton Civic Hospital, which is a world in its own.
Right.
Is learning a ton with little kids, newborns, infants, and and she's that kind of kid that she's a real global health, passionate about the environment individual.
Mm-hmm.
She's done a lot with a master's degree in global public health. She's launched a parks awareness program in the Maritimes for anxiety and stress reduction for people, where they can write prescriptions now to get free entrance to parks. Physicians can, because of her moving forward. It's a great program. They have it out west, and she brought it to the Maritimes when she was at Dalhousie Medical School.
Oh,
so
wow.
Yeah, they're all great. They're all accomplished in their own way, and very proud of them.
When you were in dentistry, though, you didn't have a desire like to go like a full specialty. You just wanted to be a general practitioner.
I love doing certain things. I love to be able to say, you know what, I'm not great at this. Come see my specialist, because they are better, faster at it than I am. And I didn't want to sort of focus in one area. I wanted to be able to do a dabble in different areas of dentistry. Mm-hmm. And general practice allows me to do that. I can sort of pick and choose what I'm best at, and the other stuff we have our specialty teams that help us out with.
Right.
I don't think there's any dentist that's great at everything. There's so many areas today that if you call yourself a hero, well, good for you. But I know my limits, and I know what I want to have help with. Right. So, and I think most patients appreciate that, and you can educate them about that. And most listen after 30 plus years.
Right. Well, listening, it's like anything, right? Experience does it. So when you got that behind your belt, it makes a big difference.
I mean, dentistry it's really carpentry on a small scale when you get down to it. And carpenters have to have certain techniques, certain knowledge, certain hands, and empathy for patients. It's not fun coming to see people like me, and we know that. So right. we try and make it a comfortable environment, with all the comforts that you can provide, and trying to keep patients, happy.
Right. What's just some fun stuff? What's been one of the most hilarious experiences you've ever had that's happened at the practice where like you were like, oh my God, like didn't stop laughing about that for days?
Oh, I tell my kids that funny experiences, and I'll try to bring one to mind that I should have kept track of those. I could have written a book and probably retired off of it over the years. But
I'm sure.
I think one of the comical ones was working on a wonderful long-term patient. I think I was leaning on my air water syringe, which rinses things out. And I think it was aimed at his pant region. And he thought he had an accident in the chair. It was actually me squirting water into his lap. And I didn't figure it out until after.
Right.
And so it was, there's been a few funny things that have happened, and good to be able to laugh about them.
Absolutely.
Yeah.
So like, I know a friend of mine who's a doctor in Vancouver, like, he has, funny questions he'll ask patients to kind of see, what direction they're going in, if they're telling the truth or not telling the truth about what's actually going on. I don't know if it kind of happens within dentistry, but one of the questions he'll ask is sometimes like, he'll say to the patient, like, do you have burning behind your eyes when you go to the bathroom? And then sometimes they'll actually say yes, which is like virtually impossible. So like, is there like, do you ever have to ask the kind of crazy questions like that, or?
Well, you kind of get a feel after you've been sort of heard a lot of different stories the first 5-10 years of practice. You kind of know when somebody's trying to close the curtains over what's really been going on with them.
Right.
So you kind of, there's certain questions you ask, and I think listening tells you more to the patient than asking questions. If you let them talk a bit, you kind of get a feel for, is this the right story or the left story?
Right.
Sometimes I'll target certain questions to them to find out if whether they're telling you about the proper medications that they've been taking, and they think that because we're dentists, we don't really need to know that. But there's a lot of health-related things that are, at risk when you're in the dental chair, and basically because of people being stressed, anxious. It changes body chemistry, blood pressure.
Right.
So we try to find out everything about our patients and the proper things, but sometimes they like to be a little secretive for whatever reason.
Not present company excluded, though. Obviously, I'm like the star patient.
Absolutely, we know everything about you, Mark. And it's all good. It's all good.
It's all good. Like, scariest moment ever when you've been practicing, or something like?
I think initially when you start practice and you get in maybe to procedures where you're maybe you shouldn't have been.
Yeah.
And you have to say, I think I'm outside of my comfort zone. We're going to send you off to see somebody. But that's the way you learn. That's the way you learn to practice. And they call it practice for a reason, I think.
Right.
So you sort of learn your limitations, hopefully early on. But listen, there's been times where, I go in to help a specialist out. They come in to help me out.
Right.
So there's certain things that specialists can and can't do because it's outside of their realm, and vice versa. So that's why the team effort and me being there when the specialists are there, it's comforting for patients as well.
Right.
So, but yeah, every area, I guess, has its limits, and it's interesting how sharing stories and with my kids and hearing them learn what their limits are as well, and how they learn to go or make their limits a little wider.
Right.
Is interesting, especially in a hospital setting. They're doing things where we have equipment in our operatories to do certain things, and many of in the hospital setting, they're doing everything by hand.
Right.
No automated equipment, so they're seeing, for instance, patients bedside prior to organ or heart surgery, transplants, and they have to clear out infections bedside without automated instruments. So
wow,
it's a different kind of dentistry that they're doing in different parts of the world.
Right.
So I hear those stories and I wonder how I would do that, but you
Right.
learn to do it.
Well, it's interesting because people think, yeah, dentistry, you think it's just going in and getting your teeth cleaned and, maybe filling the odd cavity here and there and off you go, right? But there's a lot more different components to the practicing and what can go on during just general practice.
Yeah, especially today, there's so many links in the literature with dentistry and all types of diseases. People with certain types of inflammatory diseases are linked with the same bacteria as that we find in the mouth. So
Right.
The literature is finding a lot of different things out, that if we don't have a healthy mouth, we sometimes don't have a healthy body. So
just out of curiosity, because obviously exercise is a big massive component in my life, but is there anything related to that as far as like if you exercise regularly and I mean, I'm assuming there probably is, but that has an impact on your oral care as far as like
well, I think it's exercising your gums and your teeth with floss and different dental aids that will reduce inflammation in the mouth, and it'll generally keep your body healthy, because a lot of the bacteria that they find in the mouth are linked to heart disease, diabetes, stroke, all types of inflammatory diseases. So the links in the literature tell us today that happy gums, happy you. So whether we're exercising to help our heart out, to keep our blood pressure down, to lose weight, if you're looking after and keeping the buildup on your teeth under control, I think that helps to keep the rest of us happy too.
Okay, interesting.
Yeah.
Okay, so how many times a day should you brush?
I'm a 2-time-a-dayer. Some people do it 3, 4. The most important time, and studies will show, it's before bed that you want to do your flossing and brushing and whatever else the hygienist or dentist recommends to keep things off of the teeth through the night. Same thing with infants and children. The best time to clean is before bed, when saliva flow stops, and that's when bacteria are going to have their parties and do their damage. So cleaning things before bed's most important. Most people like to clean in the morning too, which I do, because you wake up with that unhappy flavor in your mouth.
Right.
And
right.
because of either dry mouth, no saliva flow, and medications today. Many people are on multiple medications, or our geriatric population. So they may have a drier mouth, need to step up their game with doing more to keep themselves happy as well. And we try to educate them about things like that, because many medications, as I mentioned, will cause drier mouth, grinding, clenching. So we try and target and educate.
Okay. And then how many times a day should we be flossing?
The one time before you brush at night, just to loosen stuff off and brush it away. And that'll tend to keep your gums happy. There's certain other tools we sometimes use if we've had dental implants or different types of bridge work that may, in addition to the floss, help us keep things healthier. But it's usually the floss and the brush for the general part of the population, the majority, that will maintain things happily for them.
And finally, how many times a year should we come see the dentist?
Well, most people are coming in, every 6 months. There's adult populations that either can't maintain things, have had gum issues, and probably 60 or 70% of our adult population, I don't see them, but my hygienist sees them every 3 or 4 months, because that's the way to keep your gums in better form, better shape, and that's the supporting foundation for your teeth. So it's not just the gorgeous teeth of yours that we're looking after. It's the gums and the bone that holds them in position.
Yes, absolutely, 100%.
Yeah. So, and we try to individualize things for everybody. So some people can come every 9 months. Some people can come every 6 months. There's some people we see some children every 2 months, because they may be on certain medications that stain or cause issues with their gums and teeth. So it's individual, recommended, prescribed, and the patients appreciate that and understand it once they're shown and educated about it.
Fantastic. And again, you guys are located at 1916 Avenue Road. I'm assuming you're always welcome to new patients.
We love new patients. We
Excellent.
love our old patients. We love our young patients. Yeah, we're happy to see anybody and everybody. I see patients in wheelchairs. We sometimes carry them out of the wheelchair into our chairs.
Right.
We see patients with walkers. I think my youngest patient was about 102.
Wow.
Who lived in the area, who would tell me stories about how he grew up near Brook Avenue, which you know where that is.
Yeah.
And he would go get sawed at the farm up near Joycey.
Oh,
yeah. So he'd been here for a while.
Right.
Yeah. It's some great stories with the patients in the area.
Right.
And there's many patients that I book extra time with because I love those stories.
Oh, that's awesome. That's awesome.
Yeah.
Yeah. So you can see, like, it's a really, you've done exactly what you wanted. You built a community, family oriented practice, and which is one of the reasons, you and I have a special relationship, and I wanted to have you on the show. And thank you so much for doing this thing. Give me your time, because I know your time is extremely valuable. And again, the phone number to the practice, if anybody wants to call in and book a time, who maybe is looking for a new dentist or wants to make the switch, or doesn't have one and wants to contact you guys.
AvenueDental.com.
There you go.
416-256-0907. Happy to have everybody and anybody.
Excellent. Perfect.
Thank you, Mark.
Dr. Sam, all the best. Thank you so much. Give my best to Marlene and the girls and the fam and the dog. And we'll see you in the neighborhood soon for sure.
You bet. Regards. Have a great weekend.
Thanks. You do all the best.
Thanks for your time.
My pleasure. You too.
Bye-bye.